And mosquito-borne illnesses, it's what's going around. That includes dengue fever, West Nile, Zika, chikungunya. Dr. Jamie Snarski of Palm Beach Gardens Medical Center is joining me this morning. So when you hear these new reports, about mosquito-borne illnesses, we had some sentinel chickens not long ago test positive for West Nile. What is your level of concern?
So no more so than normal, honestly. We haven't been seeing any more than normal come into the emergency department. However, we are having a very bad mosquito season, of course, because of all the rains we've been having. So that is a concern. Also, people travel during the summer to other endemic areas, and that's where they're probably more likely to get some of these diseases. And
it goes beyond just, the pesky bug bite. I mean, how severe can the consequences be in some cases?
Well, most people, they don't get severe disease, so they'll get maybe like a viral flu-like illness that they can clear on their own. But some people can go on to get meningitis or encephalitis, and that's rare but can be deadly.
Who's most at risk and why?
So anybody above 60 and most people with comorbidities or anything that underlying illnesses like hypertension, diabetes, kidney disease, or those with organ transplants.
So bug repellent, bug spray, it's the obvious defense, but you go to shop for it and there are just a million options. So this is actually what's in Dr. Snarski's home right here.
This is from my home here.
Yeah, so what works, what doesn't? What can you tell people to help them guide through when they go to buy the bug spray?
So it's all about the DEET, actually, and you really want to take a close look of what you have in your closet and what you're taking with you to the beach or going camping or wherever you're going, because you want a DEET content of greater than 20%. And that's what the CDC recommends. It's safe for pregnant women as well, so that's great. But most of these actually don't have it. If you look close, they might only have 10–15% DEET, and you really do want something stronger. One of my favorite ones that isn't here is that bright bottle, that bright orange bottle of Ben's insect repellent. I love that one. It's got 20% or higher of DEET, and that's really kind of the best one.
So you really have to take that extra step, check the label, make sure you're getting the right amount. So other than bug spray, what are some other things you recommend?
So mosquitoes breed in still water. So let's first off get those things, anything with still water, out of the areas around your home. So that could be a spare tire sitting around, a potter that's filling up with water, anything that you can really think of. Other than that, there's a lot of other items. You can use citronella candles. Those are for outdoor use only, and you want to keep those away from pets. There's foggers that you can use. There are clip-on devices that you can put on your clothes that last for 12 hours or so. There's those bracelets that you can use. And also there's a gear spray that you can get. Some stores are also online. And I bring that camping and on my mission trips. You can spray it to all your clothes, your tenting, your tents, and that actually lasts through several washes as well.
Oh, that's great because it keeps it away from your environment,
yep,
not
exactly.
just off
You're
your
wearing
body.
it on the clothes, and also wearing long sleeves, long pants. That lightweight, of course, in Florida. That's all going to help.
Okay. Is anybody else itching just talking about this? Great advice, great tips. So timely too with what we're seeing right now, kind of the rise in dengue.
And absolutely don't itch because you can get a local skin infection just from doing that.
Don't itch. Okay, tough. All right, thanks, Dr. Snarski.